Dr. Babineau, thank you very much for joining us, and thanks too as well to Dr. Finale, who's going to be joining us in just a little bit. And we're trying to practice what we preach by doing an interview via Skype. Let me start with a question about your preparedness at Lifespan, Dr. Babineau, and if my numbers are wrong, correct them. 60 ICU beds, 200 ventilators that you have over there. Just down the road in New York, the governor is begging the federal government to send more ventilators his way. What is your confidence level that your infrastructure at Lifespan can sustain a massive influx of patients like we're seeing in Italy?
Yeah, thanks, Tim. Good to be with you, and I appreciate the opportunity to come on. As I mentioned earlier today, we've been preparing for this pandemic for several weeks and a couple of months. Right now, as I sit here today, we're in pretty good shape. The numbers that are coming into our ER and inpatient are really rising very, very slowly. The hospitals are actually fairly empty. Our volumes are down 30–40%. So right now, we have plenty of capacity. We only have a couple people in intensive care, and I believe as of about an hour ago, only 2 that required ventilators. So your numbers are correct. We have roughly 200 ventilators, about close to 100 ICU beds. We, learning from others, have already explored technology where if we had to, we might be able to put 2 patients on 1 ventilator. So theoretically, haven't done it, we could ventilate 400 people. Tim, at that point, my opinion is it doesn't become an equipment issue, it becomes a staffing issue. These are very highly specialized people who need to take care of the folks on the ventilator. So right now, we're as prepared as we can be. We have plenty of capacity when it comes to ventilators and ICUs. We have plenty of capacity when it comes to our fantastic healthcare workers. What's coming down the pike is anyone's guess. I think we are slowing the spread here in Rhode Island. So right now, we're in a good place.
The staffing issue, I think I heard on a podcast somewhere, which you always have to be careful where you get your information, but it can take up to 3 medical healthcare workers to operate a ventilator at once. Is that about right? And if you are running all 200 ventilators, that math would mean 600 healthcare workers, wouldn't it?
Yeah, it's not exactly that. You need a physician who can oversee more than 1 patient on a ventilator at a time, but you need a respiratory therapist that could probably 2 or 3 at a time. And you raise a good point, Tim, and I can't express this enough. And I know Dr. Finale agrees with me 100%. We have an amazing workforce at Lifespan and Care, and quite frankly, in all the hospitals in Rhode Island. These are really the heroes in this crisis. They're putting themselves at risk coming to work every day. I've never been more proud to lead this organization, and I know Dr. Finale feels the same way. And the last thing I will say is the safety of our workforce, along with the safety of our patients, remains our #1 priority. Every decision we make, every policy we put in place, it is with the utmost regard for the safety of our amazing workforce.
Let's talk about the safety of your workforce. Last week we reported that healthcare workers had to wear the N95 masks for longer than recommended, multiple days, because supplies are running low. Are you still in that mode right now?
We are, and again, we're in uncharted waters, and we're using our best judgment every single day to do what's in the best interest of our workforce and our patients. So we're doing things that, quite frankly, haven't been done before. We are using N95 respirators for 1 and 2 and 3 days if they're not soiled, if they're in good shape, and that seems to be working fine. In the old days, you'd wear it for an hour, you'd throw it away. We can't afford to do that anymore. So right now, our personal protective equipment stock supplies are pretty good and will be for a couple weeks, but we need to make sure the supply chain stays open because we will run out unless we get restocked.
And when do you know when you'll run out? When we're talking not just the masks, we're talking gloves, we're talking the full body garb. Do you have a clock on when those supplies run out on you?
Yeah, we do, and it depends on what you're talking about. The one that is in the shorter supply, N95s, we have at least a couple more weeks of that. Part of that, however, depends on what we refer to as the burn rate, which is how many you use in a day. And as we see more patients, we'll use more equipment. But right now, we're in pretty good shape, but we need to make sure that the supply chains stay open and get us what we need, and so far they have.
Have you talked directly, and when I say directly, I mean, in a mass memo or video to your staff recently, and what have you told them?
Yeah, thanks, Tim. I have a couple times. I sent out a video email last week thanking them, reassuring them, thanking them for their heroic efforts. I just taped another one not 20 minutes ago that will get posted online later today. So I'm doing the best I can to communicate with our frontline staff. And again, I can't emphasize enough how enormously proud I am. And I know Dr. Finale feels exactly the same way.
Dr. Babineau, hospital workers at Lifespan, as you know, have been diagnosed with COVID-19, and on social media, there have been people who have been at Rhode Island Hospital, been at Hasbro, and they're concerned they may have been exposed by one of your healthcare workers that have later been diagnosed. What do you say to them?
Yeah, as we reported this morning, we have a handful of healthcare workers at Lifespan who have tested COVID positive. And if you think about it, Tim, that's not surprising, since at least in the last couple of weeks, the only people who are getting tested were the ones that either the Department of Health approved or were a healthcare worker. So there's a predominance of healthcare workers being tested, and appropriately so. So we have about a handful of folks right now. We don't know whether they picked it up at work or they picked it up in the community. Thankfully, they're all home. They're all doing reasonably well. None have required hospitalization. And when we believe that a healthcare worker may have been infected while at work, and there's only been 1 or 2 cases, we've done contact tracings of the people they've come in contact with.
So in other words, if someone came in contact with one of your employees that tested positive, you have reached out to those people. So if they haven't heard from you, that's probably good news.
That's correct. That's correct. And the other thing I would add, I mean, in addition to this just medical crisis, if you will, is we're beginning to see a lot more, as you might imagine, mental health issues, right? So people are stressed. Our workers are stressed, the public's stressed. So we've seen a huge increase in demand for our mental health capabilities. So our mental health care workers are very busy. We have really ramped up our telehealth capabilities, and they're doing a lot of visits by telehealth. That's been really terrific. And I think, Tim, some good will come out of it. We're going to learn some things that I think will help us take better care of patients after this crisis passes.
So maybe lean more into telehealth. Maybe don't let as you're saying, don't let a good crisis go to waste. There could be some innovations that come out of it.
100%. And again, we have some of the best physicians and nurses around. They're creative, innovative people. They're coming up with new, thoughtful ideas every single day. Some work, some don't work. But we're testing all sorts of new ways of doing things. We're testing some of the new drug therapies here at Lifespan. So some of the chloroquine and the, I always blank on the AIDS virus drug, Residivir. So several of the patients that are here sick are on clinical trials. So we will help contribute to the overall knowledge of what drug treatments work, what drug treatments don't work.
I have to ask you about that, and I'll ask Dr. Finale the same question. Both of you are doctors, and I want your opinion from the medical side of things. A lot of people might be feeling hope when they hear President Trump talk about chloroquine and the other drug that you named, saying that they're showing real promises. Is that what you're seeing, and are you worried about people rushing out and trying to get a prescription or even get their hands on chloroquine?
Yeah, there should always be hope. The American healthcare system is the greatest in the world. We always come up with new treatments and new ideas, so there should always be hope. There seems to be some very early, very, very early promising results with some drug therapies. It is way too early to declare victory. It's way too early to say, give it to everybody. We have to be thoughtful. We have to be scientific. We have to make sure that if we're going to recommend it, there is sufficient evidence. I've been very impressed by the FDA in their ability to rapidly approve new drugs for treatment, and we're testing many of those therapies right here at Lifespan. So hope, but we're not there yet where we can just say, yeah, we found a cure. Yes, we found a treatment. Everybody run out and get X, Y, Z. It's too soon.
Again, you're a doctor. Are we testing enough people, and should the criteria of who we test be loosened?
We're not testing enough people, but it doesn't have anything to do with the criteria. It has to do with the availability of the test kits. We have been enormously frustrated, and I know the governor is frustrated, and Dr. Alexander Scott is frustrated, and we talk daily 2-3 times a day about, for whatever reason, Rhode Island's inability to get sufficient test kits and test materials. We should be able to test a couple hundred people a day. We've only been able to test 40 or 50 a day. Now, I got a little bit of good news about an hour ago that there's a new test that was just approved for emergency use, a technology by a company called Cepheid, CEFEID. We have the machines here. We've got 3 of the machines. We need the cartridges. We need the things to put the samples in to put in the machines. And we hope that we will be getting a big shipment of those cartridges in the next day or 2. If that's the case, we should be able to ramp up our testing dramatically.
Do you have an idea of how much ramping up you'll be able to do? How many more tests? You're doing 40 to 50 a day at Lifespan. How many more do you think you might be able to do?
We should be able to do a couple 100 to 300 a day if we get the kits.
And we should point out, many people might be watching this interview later in the week. We are recording this interview on a Wednesday, so that changes the time frame. How quickly do the results come back, Dr. Babineau, when somebody gets tested with this different method?
Yeah, great question, Tim. That's the great news. It's a very rapid turnaround. 45 minutes.
Wow.
45 minutes. And it's called point of care testing, so it can be rapid, high throughput. So we're hoping we get the cartridges. Literally, the FDA just cleared this machine for this particular use 4 or 5 days ago. I know the company has ramped up their production of the cartridges. I've been in touch with the company's CEO on almost a daily basis, and we're hoping we'll get some material in the next day or 2. There are other tests available as well, and we're trying to get those test kits as well. But we're particularly hopeful that this one will come through in the next day or 2.
Dr. Babineau, earlier today you said you believe the state is flattening the curve. Was that an anecdotal assessment, or have you talked to epidemiologists about how the state is doing?
It was my own personal feeling based on what I'm seeing here at Lifespan. I check the numbers 3 times a day. Every 8 hours we get an update on the number of inpatients that have tested positive. And it's been a very, very slow rise. Now, all bets could be off a week from now, 2 weeks from now. That's one of the challenges about this virus, is we don't have a full profile on its behavior. We're learning as we go. So right now we look good. 2 weeks from now, it's anyone's guess. But right now, the rise has been slow enough where I think you could infer the very aggressive social distancing policies that the governor put in place. And kudos to the governor. She's been amazing, and Dr. Alexander Scott has been amazing. I think those efforts right now are paying off.
Put on your doctor hat again. If someone at home right now is listening to this and they think they are sick, or a family member is sick, what do they do?
Yeah, if you're sick, you stay home. First of all, you don't go to work. If you're ill enough where you're getting worried that you may not be able to stay at home, call your primary care doctor, call the Department of Health. We can get you tested. But if you feel like you have the flu, stay home and treat yourself the way you would if you had the flu. If you're getting worse, by all means, come to our emergency room. You know, surprisingly right now, our volume in our emergency rooms has never been so low. Our volume of patients in our hospitals have never been so low. So we have capacity here. I'm not saying everybody rush here and get tested because we won't do that. But, you know, and you should call before coming because we can tee you up. But if you feel like you have the flu and you're managing at home, stay home and take care of yourself.
Well, if somebody comes to your emergency room and they think that they're sick, are they put off to the side? Are they treated differently so they're not brought into maybe main parts of the hospital? How do you triage when someone is a suspected case walks into your hospital?
It's a great question, Tim. Literally just today, we're putting up a separate part of our emergency room on the main campus to do just that. And it's outside, it's in a tent. Prior to that, we were putting them in a separate part of the ED. Now we're getting them just outside the ED in a tent, and they're being tested there.
Okay, just a couple more questions for you, and I'll let you go. Your corporate offices, you know, you have a lot of people that aren't frontline workers. Are you recommending to your staff in the administrative offices that they work from home?
Yes. So as of yesterday, we had close to 250 people working from home that can work from home, and quite frankly, it's going quite well. Another lesson we may learn, right, from this when we come through it. So if you can work from home, work from home. So the answer is yes.
And finally, I'm about to talk to. As you know, Dr. Finale, you both made it a point today to do this interview together, which we appreciate. We're trying to get as much information out there as possible. But as we look ahead, as we look beyond better days when we're through this crisis, should we be reading into this at all, this new togetherness that we're sensing between Care New England and Lifespan, considering all the turmoil that we've seen for the past couple of years?
Yeah, I wouldn't read too much into it other than Dr. Finale and I and all the hospitals are deeply committed to doing what's right, and what's past is past. I talk to him almost every single day since this crisis hit. We're working incredibly well together. We have exactly the same priorities, exactly the same goals. The past is the past. And who knows, maybe there'll be a silver lining in all this. Who knows?
Dr. Babineau, thank you very much for your time and good luck over there.
Thanks so much.
So, Dr. Finale, thank you for joining me. We just, as you know, we just spoke with Dr. Babineau. Both of you are doing this joint interview, and we greatly appreciate it. Dr. Babineau, optimistic on the level of preparedness when it comes to Lifespan and the number of beds that they have and the number of ventilators. Cannot predict the future, of course, but right now, as things stand, he feels pretty good about it. How about you? Are you feeling that when it comes to beds and ventilators specifically, the ability to care for those who are very sick, that you're in good shape?
Yeah, again, we don't know what the future holds. We don't know how many patients might be affected, but and we're principally looking at Kent right now, so our availability and our ability to staff up and expand the ICU is significant. Also, if push comes to shove, we're also working on trying to have ventilator ability at women and infants. So I feel as strongly as he does. We talked this morning that we're as prepared as we can be. Nobody knows what's coming, but we're certainly as prepared as we can be.
How about preparedness for your frontline healthcare workers? We reported last week that hospitals are asking healthcare workers to use the N95 masks for multiple days. Are you still in that mode right now?
Yeah, every day it seems to evolve and change. We're probably going to universal masks today. The availability of PPE, as you know, the new term, is limited. We are using a lot of masks, trying to make sure that if our staff, we call it source control, if our staff is potentially affected, we don't want them giving it to our patients. So we're worried about the supply. We're doing everything we can to maintain that supply, but we're masking everybody today.
What is a universal mask? Does that mean one person wears the same mask?
Yeah. So universal masking would mean, and we get that today, is everybody will mask, all the staff.
I see.
Okay. Before this, we were masking at certain parts of the hospital where we thought there was exposure. But right now, we're going to move towards universal masking. Yes, people are using masks more than one day at a time. They are. We're all trying to figure out how to mask everybody for prolonged periods of time. There are companies and other organizations making cloth masks now that we can use. So we're reusing them. Yes, we are, because it's better than not having any.
Dr. Finale, I'm sure you've heard it. We get a ton of emails on it here at Channel 12 and in our social media. Calls to reopen Memorial Hospital amid concerns that we could have this tidal wave of patients. Is that even on the table for you?
That's a complex question, but let me answer it the following way. One is, currently, as Dr. Babineau probably said, is we've got capacity, we've got hospital beds. The hospitals are 30, 40, 50% empty. So I think we're well prepared to handle just about any surge. That said, I think the state emergency preparedness folks have to look at all options. I mean, I haven't specifically spoken at length with anybody about the potential for Memorial. I know people were looking at it today. Memorial, as a building, has some significant challenges to be able to open up in this kind of condition. And could they get it ready in 4 to 5 weeks' time for when this surge may or may not happen? The question is, when's the surge going to happen? Is it going to happen? If they need the beds, how long would it take to take a building that's been closed for 2.5 years with no water running through the pipes, with no air conditioning? How do you get that up and running, especially with staff? So the answer is, I think everything has to be looked at, but we haven't spent a lot of time talking to folks. We haven't been officially approached.
Yeah, we know the EMA, National Guard, have been over at the Dunk. Yeah. They've been at the Convention Center. They've been down the Ryan Center. It sounds like, from their perspective, they haven't reached out to you about Memorial just yet.
They visited Memorial today.
Okay.
I know. I think I'm believe that's who visited the memorial today. So they were there today. We haven't heard from them since they came back today.
We heard from Dr. Babineau about testing and how many tests they're able to do. Right now, about 40 to 50 a day. He says woefully short, but that's because of the accessibility to swabs. He brought up in our interview about a new method of testing that has just been approved, and they have some of the machines there, and I don't know the name of the machines that can do this testing. I'm putting you on the spot, but is this a machine that you have? Do you know what he's talking about? He thinks the cartridges could come in within a few days.
Yeah, I'm uncertain as to what he's specifically referencing, but the standard machines to do the COVID-19 testing, we've received 2 of those machines. I know Tim now has 2 on site. They can do the standard testing. But the good news about that is we'll have those machines on site. Hopefully within a week we can run the tests ourselves and the turnaround time will be better. The issue is, do we have enough swabs? Do we have enough reagents? So that's the stuff we need. If we get that, he could probably run over 100 tests a day, such as we can. He may be referring to the point of care testing, which we don't have yet available. He might be able to do that. We can't.
Okay. I want you to put on your doctor hat here, Dr. Finale. A lot of people may be getting their hopes up when they hear the president talk about chloroquine and another drug to help potentially treat the disease. What is your understanding about the efficacy of those drugs?
I'm going to take Dr. Fauci's statement and say, as a scientist, and I think all of us are to a certain extent, there's no definitive data that this works. So I don't want people to get their hopes up yet. I know there's testing going on to see if the combination of the antibiotic and chloroquine work. Remember, chloroquine's a medicine that a lot of our patients take now. And if people start hoarding it because they think it might work, the people that need it are not going to get it. That medicine is used for other diseases like rheumatoid arthritis and other things. We'd hate to have those people affected and not have a supply of that medicine which they rely on for the treatment of their disease. So science not proven. Be nice if it did. Don't know.
All right, final question for you, Dr. Finale. It's not lost on me that both you and Dr. Babineau are doing these interviews together. It's been a couple of years of turmoil, I think, to put it lightly, between the two organizations. Should we be reading into this joint interview at all, and the joint interviews you've been doing during this crisis? Could there be maybe a new day ahead after we get through this crisis?
I think you should read into it that despite competition and differences or whatever they are in the past, we can work together as the 2 largest health systems in the state and really do what's best for the state of Rhode Island, and that's what we're doing. As far as there we go. As far as future, who knows what the future holds. We're both going to work very diligently together to do the right thing for our patients. And if something falls, we'll let you know.
All right, Dr. Finale, thank you for your time and best of luck through this.
Thanks so much.